Welcome to the series on demystifying the DSM, where I am going through disorder by disorder through the DSM to really talk about what are the criteria for these mental health diagnoses and maybe even how we might be treating them in the professional practice. I'm Christy Bundakumar. I'm a psychiatric nurse practitioner with over 20 years of clinical experience, and really just from my personal hardships have decided that I'm turning my pain into purpose, and I am teaching and empowering people to be on a mentally strong journey, to take accountability for their mental health. Right now, we are in the series of eating and feeding disorders. And today we are going to be talking about anorexia nervosa. This is likely the most serious eating disorder and really needs a lot of time and attention to. But since we're kind of quickly going through this DSM, I want to just focus on what is the DSM criteria for anorexia nervosa and how is that different from other diagnoses. And then at a later date, we'll maybe do kind of a deep dive into eating disorders. So anorexia nervosa, like everything else in the DSM, has criteria that needs to be met in order to say someone has anorexia nervosa. Now, the reason we say nervosa after is because anorexia by itself is a medical condition in which you are severely underweight. Okay, so anorexia means severely underweight. Nervosa means it's a behavioral mental health disorder that is causing it. Okay, the medical criteria or the DSM criteria is one, that there is restrictive eating, restrictive energy intake with a consciousness about output. So whatever they're taking in as far as food, they're making sure that they are expending that out. Okay, so it's a very restrictive eating potential there. So that is the main criteria. And to meet the criteria for anorexia nervosa, you actually have to have a BMI less than 18. So sometimes we'll diagnose with kind of borderline anorexia nervosa or restrictive avoidant disorder with eating disorder behavior, if they're not actually severely underweight. So once someone gets to the point of anorexia nervosa, their BMI is less than 18. So when we talk about BMI, this is kind of a calculation between your height and your weight, and normal is, anything under 20 is considered underweight. 20 to 25 is considered normal. 25 to 30 is considered somewhat overweight, and 30 and above is considered overweight or obese. Again, I don't like these kinds of scales. I can be completely honest. My BMI is 28, which is considered overweight. And I feel okay with my body. I feel like I am at a healthy weight. And so these numbers are not, I don't want you to take these numbers as absolutes, right? But when we're talking about someone with anorexia nervosa, they have less than 18. So 20 and under is underweight, and they have less than 18. And some of them have as low as a BMI of 15. So it's a very serious condition, including medically, because now you're talking about nutritional deficits and actual starvation in the body. The criteria 2, which makes it very different from a restrictive avoidant disorder, is that there is an intense fear of becoming fat. And the perception, so criteria C, is that there's a distortion in perception of what they actually look like. I remember when I was working at an eating disorder inpatient facility, they would have girls, they'd take a big sheet of long white paper and they would lay them down and like draw around them to show them the size in which they are, that they are trying to give some physical or objective data to kind of counteract that perception. So those are the three main criteria for anorexia nervosa. Now, again, anorexia nervosa and bulimia nervosa, which we'll talk about next week, are very complicated psychological, medical, psychiatric disorders and need more than 10 minutes to explain what they are and how to treat them. So this is just the start. We'll talk about maybe in the future doing a series specifically on this. But the diagnostic criteria, A, is that restrictive eating with less than 18 BMI. B is an intense fear of becoming fat or being fat. And C is a distorted perception in the reality of how thin they are, how serious what they're doing to their body is, and a distortion in kind of their shape and how they are perceived by others. Anorexia nervosa has two types. It's the restrictive type and the binge and the binge purge type, not to be confused with bulimia nervosa, which is a binge purging disorder. Remember, in anorexia nervosa, there is a significantly more nutritional deficit and medical component and seriousness of treatment. So the restricting type just restrict their calories, whereas the binge purge type will actually eat and then purge. When I say eat, they will eat maybe 100, 200 calories and purge that. Different than rumination disorder. Remember when we talked a couple series ago about rumination disorder? There's not a consciousness about this intense fear of being fat. There's not a consciousness or this distortion in perception of what they look like and how they're perceived to others. So those two types still meet that criteria of being severely underweight and being very restrictive with their eating. Even the ones that are purging are not eating enough calories to sustain them even before purging. Different than a binge eating disorder that might actually consume hundreds, if not thousands of calories in one sitting and then purge. And we'll talk about that in bulimia nervosa. And anorexia nervosa, they are maybe eating 100 calories. They're maybe 200 calories, and then they are purging that. So we just differentiate the restricting and the binge eating just to know if there's additional concerns with their GI side effects and those kinds of things, if they have that purge component. But they are severely underweight. Less than 18 BMI is the initial criteria, but oftentimes we see them at 15. So how do we treat anorexia nervosa? It is actually a very complicated treatment, and unfortunately, it is very difficult, especially in the outpatient setting. You need a dietitian on board. You need a counselor and someone doing med management. There needs to be this kind of wraparound type of care. And the best care is initiated inpatient, where they go and they spend 30 to 45 days inpatient and then maybe do an intensive outpatient where they are kind of relearning how to integrate into the world of food, because food, we cannot avoid food and we need food. And so it becomes very complicated, and the layers of which are the psychological component, there's often many layers around it, and then there's a psychiatric component. Oftentimes there's comorbid depression, anxiety, PTSD are very common in anorexia nervosa, and we need to treat those things with antidepressants, Sometimes we need to actually force them to eat. We call it refeeding. And you have to do it very carefully because there's something called refeeding syndrome, which you could actually cause severe medical problems if you force them to eat too quickly. And so actually a very complicated treatment regimen needs to be wrapped around people with anorexia nervosa. The most important thing that I want you to get out of this video is how to recognize it. The earlier the intervention, the better. We see children as young as 8 years old meeting criteria for anorexia nervosa. Likely it's more between the ages of 12 and 15, maybe 15 to 18, but there's usually some evidence in that 12 to 15-year-old range. And so if you are concerned that your child has anorexia nervosa, or someone you love has anorexia nervosa, or maybe yourself, this is one of those hard stops for me that you need professional help. Yes, you can continue to follow me. You can learn the Mentally Strong method as a component to your care. But anorexia nervosa is very serious and very hard to treat. And the longer you go without treatment, the harder it is to retrain yourself on what is healthy and what is good for you and what is good for your physical body, but also your mental and emotional and spiritual body. So a hard stop for me, if you meet criteria or someone you love meets criteria for anorexia nervosa, please seek professional help. There's lots of modalities that can be beneficial, but it's very individualized kind of treatment planning and looking at all of those things. So if you or someone you love is showing signs of anorexia nervosa, please seek professional help and continue on this journey of mental strength. It's part of your story. It's part of your journey, but you need to take a step back and really get the help that you need. The earlier, the better, because the long-term effects are very physical and very medical. So that is our Demystifying the DSM with Anorexia Nervosa. Continue watching, subscribe, like. Let's continue on this journey of mental strength.